Signs of high blood sugar should be detected early to prevent diabetes. They may lead to severe problems if we ignore their symptoms. We have seen people dying because of high blood sugar levels. It is extremely an extensive disease, which can cause severe side effects like blindness and rotting. Most doctors recommend a particular diet plan for preventing high blood sugar at a very early stage. There are various types of diabetes, such as type 1, type 2, and gestational diabetes. The low production of insulin in our body causes this problem. In the case of type 2 diabetes, there is enough insulin production, but they are mostly ineffective insulin. Gestational diabetes is also caused due to less insulin in our body during the time of pregnancy. The most common type of problem is type 2 diabetes. Although they have different forms, they usually have similar symptoms. So how to detect the symptoms of blood sugar? Sometimes we fail to detect the signs of high blood sugar at an early phase that leads to grave complications in our body. So, let's look at some of the symptoms, which are generally seen before the advent of this problem. Number 1. The feeling of thirst. If you are feeling thirsty after drinking jars of water, you may have diabetes. It's always advisable to consult a doctor if you notice this type of problem. Number 2. Urinating frequently. Visiting bathroom frequently for urinating may be signs of high blood sugar in your body. Number 3. Blurred vision. If you aren't able to see images correctly and having a blurry vision, then you should consult a physician for knowing the reason. This can also be a symptom of diabetes. Dry skin and itchiness are also caused due to diabetes. Number 4. Feeling tired. Because the body can't use glucose for energy properly, a person may feel unusually tired. Number 5. Headaches and difficulty concentrating. High blood sugar can cause headaches and difficulty concentrating in a fashion similar to polyphagia, in which starving cells send out hunger signals because they can't access the glucose circulating in the blood. And when brain cells have difficulty getting the fuel they need, they function poorly. This can cause problems with thinking, reasoning, and remembering, difficulty staying focused on tasks, and headaches. Number 6. Constipation or diarrhea. Both constipation and diarrhea can be caused by high blood glucose, acting on different sections of the bowel. When neuropathy from elevated blood glucose affects the enteric nerves, the gut's command and control system, in the small intestine, the result can be dysfunctions in motility, leading to delayed emptying into the large intestine. This causes the stagnation of fluids in the small intestine, allowing bacterial overgrowth that causes bloating, abdominal pain, and diarrhea. Frequent diarrhea is seen in 22% of people with diabetes. Number 7. Erectile dysfunction. Erectile dysfunction, or difficulty maintaining an erection, is a common side effect of high blood glucose, and roughly half of men with diabetes over the age of 50 experience it. A healthy erection requires healthy nerves, healthy blood flow, the right balance of hormones, and sexual stimulation. Number 8. Feeling hunger. If cells aren't able to gain access to glucose, they send out hunger signals via a variety of signaling hormones, including leptin, ghrelin, orexin, and peptide tyrosine. All of these hormones signal the brain's hypothalamus to trigger the sensation of hunger. The cells have no way of knowing that they're starving. The glucose they need exists in abundance nearby in the bloodstream, but the relative deficiency of insulin makes it inaccessible. This ultimately leads to hunger that perversely makes high blood glucose worse when a person responds by eating. Number 9. Weight loss. Even though you may be eating like crazy when your blood glucose is chronically high, you will still lose weight. Number 10. Infection. Urinary tract infections and yeast infections can occur in both men and women, but they are much more common among women, and they're particularly common among women with diabetes. In fact, women with diabetes are 2 to 3 times more likely to have bacteria in their urine than women who don't have diabetes. Both bacteria and yeast thrive in warm, dark, moist places and feed on glucose. Chronic yeast infections are common in women with chronically high blood glucose. Number 11. Slow healing. High blood sugar dramatically slows the healing of skin and soft tissue infections because neutrophils, the most common type of leukocyte in the immune system's arsenal, are particularly vulnerable to high levels of glucose. High blood sugar keeps the neutrophils from sticking to the endothelium, the inner lining of the blood vessels, disrupts chemotaxis, the body's chemical signaling control system that directs neutrophils to the site of injuries or infections, and, as noted above, makes phagocytosis sluggish. High sugar symptoms are almost indistinguishable from low blood sugar or hypoglycemia symptoms in most cases. It is important to understand that no matter which condition you may suspect you have, seeking medical attention is always advisable. If left undiagnosed and untreated, both low and high blood sugar levels can cause significant health issues. If you like this video, please like and subscribe to my channel and press the bell icon to get new video updates.